Welcome to the Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Hello everybody and welcome to episode 35 of the Hair Loss Show. I am Dr. Russell Knudsen.
I'm Dr. Vikram Jayaprakash. Welcome.
Today's topic is something that is basically a personal philosophy of we two doctors. Not everybody would agree with it, so I'm going to put that warning at the front of this. This is something that we believe is useful, and we'll explain our reasoning behind it. So customized dosing of finasteride means not going with the regulation dose. When finasteride was released, the dosing was 1 milligram per day, and that still remains the recommended dose. There is other drugs that have come on the market at a certain dosing, and that's changed over time. The recommended dose is not going to change for finasteride. I'm pretty sure about that. But that doesn't mean that if you look at the individual circumstances of the patient, that we can't maybe vary it. The goal here is to use a small dose that is lessening the risk of them getting side effects. And that really is what we're doing here, without losing the effectiveness of the medication. So what we're really trying to say is we still need an effective dose in the system, but we want to base that on the chemistry of the drug.
That's right. So, and there's no real hard and fast, hard and fast rule here, and we will vary the dose on a case-by-case basis, depending. But we generally have a dosing schedule that's slightly less than what the current recommended dosing is. But basically, the key points are: does this slow down my hair loss? If that's the case, that's a tick. And am I getting side effects? If you're not, that's also a tick. And whatever the dose is, the minimum dose that will get us, checking both of those boxes, that's the correct dose.
And it's going to be different amongst different people.
That's
so
right.
a concept that I want you to think about is balding aggressiveness. Okay, so what I mean by that is that if I've got a 19-year-old in front of me with a lot of hair loss, very low doses are unlikely to work because he's a very sensitive patient with a lot of DHT creation in his follicles. If I have a 55-year-old or a 60-year-old in me with minimal amounts of hair loss, he's like 45 years post-puberty with a small amount of hair loss. There's just a trickle of finasteride really should control that. So this is how we make our decision, is based on what we see in front of us. The age of the patient, the degree of balding, how fast is the baldness progressing? Is it almost imperceptible that he's lost a little bit in 5 years, or has he lost a lot in the last 12 months? So just to take you back to the chemistry to make this make sense for you, there's a concept of what we call a half-life, which is the time it takes to get from a single dose getting to the peak blood level and coming down to half the peak blood level. We call that the half-life. So in the blood for finasteride, that is 6 to 8 hours. If it was an antibiotic, you'd be asked to take it 3 times a day. However, in the tissue, in the hair follicle itself, the half-life is 30 days. A single dose will still have half its peak dose effect at 30 days. So the logic of using it daily escapes us, which is why for the last 23 years I have been prescribing lesser doses than the recommended dose because I just don't see the logic in it.
So we're not looking at what the DHT levels are in the blood.
Nope.
Because that's not important. Okay, so we never measure, we never do bloods on male pattern hair loss, for example, because
it's a peripheral conversion inside
right.
the follicle that counts. So you're trying to block the enzyme inside the follicle.
If we had a way of measuring the DHT at the level of the hair follicle that was easily done and reproducible, sure, we would do that, but that's not, we don't. So we're working on the assumption that it's at the level of the hair follicle that's important, and we want to bring that level just below that threshold that causes the miniaturization process to happen.
So the next thing we need to remind you about is the what we call the dose response curve. Okay, so a dose response curve, to draw it for you, means you take a dose and you measure the level over time, and it flattens out at a 0.8, roughly 0.8 milligrams. Okay, so if you're down here at 0.5, it's mostly effective but not fully effective. Down here at 0.2, for example, you're at this part of the curve. So when people think in terms of numbers, you need to think in the chance of it having a likely effect. and most people are using 1 milligram, right? So it's up here because it's easy to measure, and it's just above where the dose curve flattens off. So the question is, how much is enough? And that's going to be a little bit of educated guesswork. So again, we look at the age of the patient, we look at the degree of balding, and we look at the pace at which the balding is advancing to decide. I would only use 0.5, for example, if the patient had a history of reacting to 1 milligram, and I want to reintroduce it at a lower dose to see whether he can tolerate a half a milligram, for example. But normally I would start with 1 milligram. But the customized dosing isn't just about the amount that you give, but how often you give it. So because we know it's long acting, we could say it's essentially an irreversible block of that enzyme. But your body makes new enzyme all the time. So we have to mop up the new enzymes as we go along. And so this is where the interval dosing comes in. And we typically will start with most people with 3 times per week, because we feel that that gives you 3 milligrams per week, which is not the 7 milligrams per week, that is the recommended dose. And we'll adjust down from that if we think that the patient is experiencing side effects.
So that's what our normal practice is. We all start at for most people, we'll start at the 3 milligram dosing. And we get a lot of comments, well, should I start at 1/4 milligram? Should I start at a 1/2 milligram? And then build up. And, the thought, and it's, you look at this graph. That's the thing to look at, because if you're starting at 1/4 milligram, sure, there are going to be people out there that are going to respond well. And they're outliers on the bell curve. They will, they respond well to a lower dose, but most people won't. So you may take the 0.25 milligram, and you may not get any side effects, but you may more than likely probably are not getting the effects.
Kind of wasting your time.
That's right. So it's trying to find, again, what is the minimum dose. So starting at 3 milligrams, remember, it's a tiny dose, 3 milligrams. I mean, because the recommended dose is 7 milligrams per week.
And if you have prostate enlargement, it's 35 milligrams a week.
So that's where it started from.
This is 1/12 of the dose that the prostate patients take.
That's right. So starting on what is a very small dose, and we find that most people will start on that and will not suffer from side effects. But if they do, then that's worthwhile.
So if the tissue half-life, if the half-life in the tissue is 30 days, the next thing that we need to consider is, does it build up in the body over time? And the answer is yes. It can build up in the body over time, even at 3 milligrams a week. So to remind you what we talked about in episode 4, some patients react in the first 2 weeks. Some people take months before they react, and that represents a build-up in the system over time because of the 30 days tissue half-life we're talking about. So I find it quite comfortable for me to tell my patients that you can stop for a month every 5 or 6 months, because it helps clear it out of your system. And every bit of finasteride is out of your system in 90 days, right? 90 days after you took that last pill, there is no finasteride in your system. At 30 days, it's half what the peak dose is. At 90 days, it's gone. So yes, you can safely stop finasteride for weeks, even a month. I would be a bit leery about stopping it for longer than 3 months, but I'm pretty comfortable with people stopping for a month, and I'm okay with them stopping for 2 months.
Yeah, I mean, I sometimes say, look, it depends on the scenario, because so if someone's trying to get pregnant during that time, then I go, look, even a few months off the medication, you're not going to lose a huge amount of ground if you're not
for most people,
if you're not an aggressive balder. So coming back to the dosing schedule and getting the peak levels, well, yes, over time the levels are going to build up. And they're going to build up even if you're on a smaller dose. They will take longer to build up, but you're probably going to get that,
still get the same issue eventually. So I guess the thing that I'm trying to do here is to say to you, don't obsess about the number of the dosing necessarily, whether 0.2 adds to 0.2 over time. And we're going to be guided by response, right? And the 2 responses we're looking for are effectiveness of blocking further progression of the hair loss and absence of side effects, and we'll adjust according to that. So that's going to be our guideline rather than saying we have to hit a certain sweet spot
Yes.
of 0.4 or 0.6 or 0.7, because that's going to vary from patient to patient.
And this comes to another point, and I know this is not so much to do with customized dosing, but it almost does. But sometimes, we will prescribe the 1 milligram tablet, but in certain scenarios, we'll also prescribe the 5 milligram tablet and get the patient to cut it up into quarters, with a pill cutter. Now, ideally, one of those quarters is 1.25 milligrams, but no one cuts the tablet up perfectly into quarters. So some days you're going to get 1.1, some days you're going to get 1.3. I always tell my patients, don't stress about it. It's going to wash out.
And by the way, the 5 milligram cut into quarters is purely a cost-saving device. There's no increase in efficiency of it. It's purely done as a cost-saving measure for people that are very, very price sensitive.
So don't worry if the dose that you're taking on consecutive or on alternate days is a slight bit different from the dose that you took the previous. It's not going to make a difference.
We're using finasteride for a cosmetic purpose. We're trying to preserve hair or improve hair, right? We're not trying to save your life. So we feel comfortable about varying the dose around it to achieve our two goals, effectiveness and lack of side effects. It's not the same as if we're trying to treat someone with a life-threatening or a serious illness, and we would be much more rigid with our dosing. We're giving ourselves a bit of flexibility here.
That's right.
Because we're trying to save your hair, not trying to save your life.
Very good. Well, I hope you find that information useful. Again, if you've got any comments, please leave them in the comment section below. If you've got any questions, then please keep those coming as well. And we'll see you on the next episode. Thanks very much.
Bye.